It's incredibly important that nurses today get experience in primary care. The government agenda is actually emphasising the importance of more and more patients being cared for in the community, and care is being shifted into this area. Patients and clients out there want to have care close to their own homes. If you were ill, I'm sure you would like to be nursed in your own home, and this is what the majority of patients want. So you have the opportunity for care for clients and patients in their own homes, in clinics and GP surgeries, in walk-in centres, maybe in nursing homes, and many other areas as well, sometimes in social services. The other thing you have a great opportunity to do is actually to explore working in a multi-professional team. I think this is so important for all nurses to really understand, and working in multi-professional teams is a key part to working in community. Not just other nurses, but with doctors, GPs, those working in social services, and maybe even those in education as well. So huge numbers of opportunities. You also find out much more about community health, understanding about health of populations and making sure that the healthcare that's being provided meets the needs of local populations. You will find out much more about your patients. It's so important to understand that patients aren't just somebody that has something wrong with them, but live in their own home, in a community with their family around them. I think it's really important that all student nurses experience nursing clients in community settings. You really then gain an appreciation of the patient as a person, living in their own home, in their community setting, and also all the factors that are going to directly influence their own health. Finally, community experiences are really important. For your future profession, for your future career. You might, in the end, decide that actually this is not for you, and that's fine. You at least have that real good understanding, so when you're a nurse in a hospital and you're referring one of your patients out to a community staff nurse or other nurse, you know exactly how it's working. But I think more importantly, on qualification, many of the nursing opportunities are going to be in primary care and community settings. There's going to be much more flexibility about patient care, and so this is a really great opportunity for you to find out more about it and be ready to apply for those jobs when you qualify.
My role is a community matron. It's quite a new role that the government brought in, and it's to try and reduce hospital admissions. People with one or more long-term condition who fit my criteria, I'll go and case manage them and try and reduce the amount of hospital admissions they're having per year, so therefore reduce the expenditure on the NHS. We're quite proactive in our role, in that we'll go and actively seek out patients that are attending the GP surgery, or if often they can't get into the GP surgery, then we'll go out and see them. We act as the coordinators, so we tend to pull all the services together. So we'll work with social services, the GPs, the district nurses, and the secondary care setting, intermediate care. So we tend to be the problem solvers, so we'll get a referral from the GPs or the consultants, and we'll pick up that referral, we'll go out and see the patient, and then we come out with, we do a very complex assessment, and we come out with a list of problems, and we work through that in order to prevent them from going into hospital. So we're proactive, not reactive to a problem. A typical day is I will go and see my first patient at about 8:30 in the morning. I'll basically assess them, so we do a full set of assessment, full set of observations, so blood pressure, pulse, oxygen saturations. We assess the chest, so we have a listen to the chest, listen to the heart sounds, abdo, and we weigh them. So we literally do the full MOT and then decide if anything needs adjusting in their medications, if we need to speak to the doctor or speak to any services while we're there, we will do at the patient's house. They all have a patient health record, so they get to keep the notes in the house. So any other services like the paramedics that'll come in, if they need to go in, then they know what we've done that day, and they will often ring us and say, oh, by the way, I went to see your patient last night because they phoned the ambulance. Can you go in and review them today? So we work very closely with different disciplines.
Just finally, if you had to sell your job to a student nurse who's thinking of applying for their first post in the community, what would you tell them? How would you sell it to them?
Great. It's a very autonomous role. That's the good thing about the community. It is very varied, very exciting, lots of movement and changes happening. You've got to be quite dynamic, you've got to be a good communicator, and you've got to be quite creative in your day-to-day work.
I'm a full-time paediatric staff nurse working with the continuing care team offering respite and nursing care in the home and other community settings in Reading, Wokingham and Newbury, and it's an opportunity for parents to go out, so we offer respite care. They're children with complex health needs. These are children who need help with breathing, artificial feeding, unstable seizures and heart defects, and sometimes it's short time that we look after them, or sometimes it may be for longer periods we look after them. It just depends on the nature of the child and the condition they have. I liaise very closely with the wards because some of the children might have to go in an emergency to the wards at the Royal Berks. OTs, occupational therapists, physiotherapists, social workers and the special education needs team, because obviously we need to discuss the children and the families and update each other on their well-being. Typical day varies very greatly. We might get a child up between 7 and 8, get them ready for school or whatever the parent, if they're younger then we'd obviously get them ready for the day. I might bath them, shower them ready for the day, then after getting them up and they're ready, move on to another family. Or I could go on to another school package where we provide nursing care for a young person. Then during that time I might pop into the office, catch up on nursing notes, having team meetings, seeing my manager, and then possibly towards the end of the day I might see another family after they've come back from school. It's a very varied, rewarding job. Each day is different because I'm caring for a child one-to-one in their own environment, which is better for the child, better for the families. And we get to know the families really well, so we get to know the children, the families, and we are a small team, well supported by our manager, because obviously you need to discuss and you need to have support as well, so it's a very close family.
I'm obviously, in terms of my background, have a specialism in community nursing as a lecturer, and I have had quite a long association with the community in terms of practice. So my role really is to enhance the students' experience in their varying experiences in the community, really to support them as well while they're out there. I'm quite fortunate in terms that I am with the students actually in practice itself. I'm not based in a classroom. I do have facilities whilst in the community of classrooms, but I tend to see students where they are actually working sort of hands-on in practice itself. So my role is to support the students out there, to enhance their learning, to facilitate where I can with other practitioners who I have fairly strong links with, I think, from the years of meeting. And so really I work with the students and also with their mentors and practitioners to ensure that the maximum amount of experience that they can gain is met while they're there in placement. Well, it's a very varied experience now. Nursing in the community isn't simply a kind of traditional one of going into people's homes and caring for people in their own homes. It can be in community hospitals, it can be in community clinics, it can be with specialist nurses. They're working with epidemiologists and public health now. The role is very expanded, and the students have a full range of experiences with all different types of specialisms and practitioners in many different areas throughout their 3 years. We tend to try and ensure that the students get sort of 50% of their community experience balanced against the 50% in more acute areas and hospital environments. So I give quite a lot of support in terms of the first year, but also a lot of it is my support to clinical mentors who are looking after the students while they're there and enhancing their total experience with them. So I kind of, in supporting the students, I'm actually supporting their mentors as well in the process. It's quite varied really, the shifts. It depends in which placement that they're having. So if they're in a community hospital, it might be quite straightforward, earlys, late shifts. They may even do a night shift. It's a very flexible approach, I would say. If they are working with a health visitor, it tends to be a little bit more structured in terms of the work pattern. They don't tend to do quite so many evenings or weekends, that sort of thing. But it's a very flexible approach, and it's tended to be geared by the mentor of the student. So if there's something that their mentor, their facilitator in practice feels that it would enhance the student's educational experience by staying, to see or observe or coming in later for, then that's really sort of guided by their clinical mentor.